Hi, I'm Dr. Teck Kee. I'm a cardiologist by training and my area of interest is interventional cardiology. I've been a doctor in practice since 2004 and I had my further training in cardiology in Singapore as well as overseas under a special government-sponsored trip to Australia where we learned interventional cardiology and complex intervention. Well, heart screening is important because if you haven't gone for heart screening, you may not discover what could be wrong with your heart. You may not need to have symptoms before you come and see your heart specialist because by then it may be a bit too late or you may have advanced disease already. So having heart screening early helps us to pick up whether there's anything that is starting to go wrong with your heart. And like the old saying goes, prevention is always better than cure. So if you're going to have a problem, it's best to find out early rather than later. That is why you should go for heart screening. Well, heart screening is actually a very broad heading. How is it conducted? I will maybe divide it into a few categories. Mainly, we'll classify it into risk factor detection, where we screen your blood, we take a detailed history from you, we physically examine the patient to detect whether there are any underlying physical signs or heart symptoms. And then the blood test wise, we're looking for things like do you have diabetes, is your cholesterol elevated, etc. And then under the specialized investigations, there's a whole gauntlet of it. It's too much to talk about on video, but I would say you can categorize it into maybe tests to measure the pressure system, tests to assess the function of the heart, tests to assess the pipes of the heart, also known as the heart arteries, and tests to assess the electrical system of the heart, the wiring so-called of the heart.